So we've talked about so many advantages for AI, and we did talk about lack of empathy and all that. But what do you think is one of the most important downside for AI that we should all be aware of?
That's a very good question, Najma. I would say that, with computers coming up, I'm talking about my personal experiences, that, when we were using at mental maths, so we're using a lot of mathematics, but now we have calculators, so we forgot mathematics. Now, same thing is going to happen with me if all the important decision or critical thinking is going to be done by the AI. Do you think as doctors, we'll lose this very important skill of critical thinking? Because you'll put all the data into your computers, the system will think and maybe think better for you and give you the answers. Do you think we'll stop thinking about it? Do you think we'll stop doing critical thinking? This is
You're
one of
right.
the most important things which I feel that is a problem for us. But other important thing for us is that right now we don't really have any data security, because all this, we're talking about artificial intelligence is all based on big data. Now, this big data is stored somewhere, and we really need to be sure that this data is used ethically. We also have to be sure that this AI is used ethically, because a lot of ethical issues involved in the data leakage and leakage of personal information, which probably is going to be available to the whole world. So that is something which I need to be aware of. And of course, we should not stop thinking, only take help from it. Even as
Absolutely.
students, I would suggest you the same. Don't give assignments to AI, use it to help and support yourself.
You're right. You're right. And one last question. What's next for AI in healthcare? Where do you think is the direction for it?
Excellent. As I told you, it's really going to replace many of the common jobs which a doctor would do, and also help us to make accurate diagnosis, make personalized treatment plans, and also give better patient outcomes. So this is something which is coming up in near future. It's also coming in. But something which is very interesting, which is going to come in future, is what we call as artificial general intelligence. Right now, we are in a phase of what we call as generative AI, in which you tell the computer or system to do one particular job, it does it. But we're talking about artificial general intelligence, which is known as AGI. If it comes in, it's going to be amazing and path-breaking, because we're talking about various inputs from various sources. We're talking about audio, we're talking about video, we're talking about intelligence, we're talking about data. Everything, when it becomes integrated, imagine how much general intelligence a computer system would have, and how much it will be changing the whole world. So that's something to look out for, AGI, and that's something going to be actually a new different world. So that's going to be simply amazing.
You're
We're
absolutely
all looking
right.
forward to it.
Thank you so much, Dr. Pankaj,
Yeah, and
for
thank
your
you so
time.
much. And I really want to close with something else. An important aspect of doing AI is teaching AI to our medical students.
You're
And
right.
that's why we also ensure that in our curriculum, we have actually introduced AI and data sciences all throughout, for example, in your medical school. And you'll be learning about AI, because knowing AI is one thing, how to use AI ethically is another thing. So we're all training all of you, and really wish you all the best in your future career. Thank you so much.
Thank you
Thank you
so
so much
much.
for speaking with me, Najma.
Thank you. Bye-bye.
Bye-bye. Take care. See you.